Welcome everyone to our fireside chat about mental health 1 year into COVID. Why are we doing this? Who are we? I'll introduce myself, and I'm going to let Nicole and Anna Pam introduce themselves when I sort of turn things over to them when I ask them the first questions. But we've been working at Azrieli since the beginning, but certainly over the last year, really trying to support people with developmental disabilities and sort of help them with their mental health at this time, and also do a lot of work with families. And so some of that stuff has been directly in the clinic. Some of it has been through different courses we've been involved in. And Nicole and Anna Pam and I have been involved in a course targeted towards service providers who work in healthcare and also who work in social services around mental health and COVID and developmental disabilities. And we actually meet almost every Friday since COVID started, hearing about cases in the community and giving advice to people around sort of things they can do in those cases, that kind of thing. And at the same time that we've been doing that work, there's been this other work going on with families, or we've been meeting with families and sharing information, doing some mental health education with them, and listening to some of the stories and experiences that families are having. And we thought it might be really helpful in our last family course we were running. So if any of you are from that family course, we'd love to hear from you, and you can put something in the little Q&A or chat box to say, oh, I'm from the family course. But we heard this question again, like, that's all well and good, but what do we do now? Because it is 1 year in since all of this started. And I think you know as families better than any of us really, just how major that is in terms of impacting you as family caregivers and also impacting people with developmental disabilities. So we have some people here from across Canada who've joined us today. And we just wanted to have an honest sort of conversation reflecting on things we've learned over the course of the pandemic, and maybe we're offering a few suggestions from our different perspectives that we bring around things that might be helpful right now. And it might be the same stuff we were talking about a year ago. Some of it might be different. Challenge each other a little bit and have some questions that we bring to each other. So as I said, my name is Yona Lunsky. I direct the Azrieli Adult Neurodevelopmental Center. I also have a sister with a developmental disability, so I think about family issues a lot. And I'm a psychologist by training. So I'm going to ask Anna Pam and Nicole to introduce themselves and sort of what they bring to this table, and then I will ask them the first big hard question. So I'm going to say first, I'm going to go on mute, and I'm going to ask Anna Pam to introduce himself.
Thank you, Yona. I'm Anupam Thakur. I'm a psychiatrist at CAMH and Surrey Place in Toronto. And thank you so much for having me. I really look forward to this discussion.
And Nicole, do you want to introduce yourself?
Hi, everyone. My name's Nicole. I am an occupational therapist, and I had the privilege of working with Yona and her team at Azrieli last year. And now I am an assistant professor at Queen's in Kingston, Ontario. But I think most importantly, the hat I will bring today and that informs my work is that I am a bossy older sister. So in my work and in my life, family is front and center.
Okay. Thank you both, and thank you for being here with us. I wonder, and maybe we'll start with you, Nicole, if you want to think about some of the things you've been noticing that sort of across all these different cases we've been hearing about from across the country. What are some of the things you're noticing that are issues right now when it comes to COVID and mental health?
Thanks, Yona. This might not be surprising to anyone, and I'm not sure if you know much about occupational therapists, but we believe that health is achieved through doing things that are meaningful to you. And right now and over the last year, we've seen a huge disruption in routines and the ability to participate in things that bring us joy and help us cope, and just the overwhelming loss and stress that has come with those disruptions, I think is taking a huge toll on families, on all of us, and we just have varying abilities and resources to cope with that. So I think, this past year has really hit home to me. What we do every day matters for our health. And not only that, but who we do with it matters. So that loss of social connections, the ability to see our loved ones and participate with our friends is taking a real toll. So I think that's what I'm hoping to chat a little bit about today. Thanks, Yona.
Thanks, Nicole. Anna Pam, do you want to talk a little bit about what you've been observing, sort of a year in, what stands out for you?
Yeah, I've been reflecting last couple of weeks on this. March 11th was when last year when it was declared a pandemic, and we very swiftly switched on to different kinds of modalities to provide care, including virtual care. But what I've seen is that the things that Nicole mentioned, and that affects all of us. Thinking about unpredictability, thinking about new structures, thinking about um, uh, overload of information, be it through television, internet, lots and lots of information. Um, Anxieties about what next. So when we look at overload, ICUs, there are not beds available, or there are services that have been stopped. Certain organizational supports are not able to cater to what they have been doing for a long, long period of time. We were coming up to summer. I was thinking about summer camps. Some of the persons I work with were always look forward to the summer camps. They are going to be stopped. What to do next? So it was always about trying something different every day, almost every time that you're working. And that was not only about mental health or from a professional perspective. I think if I look at inwards in my own personal life, the same kinds of things, everything changing every other day, almost like shifting sand. Um, but I think we have learned a lot. I think we have also learned things that perhaps we could have implemented even before this pandemic to make things work better for all of us. So I would not say this is a kind of a positive thing, but I think there are several things that we have learned. And perhaps we can develop on this further once we have got over this pandemic.
Yeah, I think it's a really interesting point. The things we've been forced to learn that maybe would have taken us 5, 10, 100 years to learn had this not happened. So we will spend some time, I think, this afternoon talking about some of those learnings. I just want to comment a little bit on part of what both of you are saying. I think, the loss of meaningful activities from an OT perspective, Nicole, and you mentioned some of the overload and stuff that's been happening to people in terms of all the information. And I guess one thing I'm seeing, even in terms of like who's participating in activities when they're offered now and how people are participating. I think earlier on there was maybe more enthusiasm around like activities that, a parent or sibling might want to do with the person in their family who has a disability online together, right? Trying to figure out how to make virtual stuff work or things we're all looking to do. And it's just the fatigue of all of this has made it that we just have that much less of ourselves to give on screen. So we're seeing, for example, fewer activities that families are signing up to do together. I've heard from family caregivers, I'm really just looking for something for my loved one to do where I actually can take a break and I don't have to do it with them right now. Or to be honest, I just can't imagine. Like we used to think the best time of day for people to do activities is evenings because you're not at work and people are home, we finished dinner, let's do this activity. But people are just glazed on screen at night times. Every time people have the ginormous amount of energy that it would take, I think, to go virtual on screen at that time. I think that's one thing I've observed. And also, I think one thing that seems to be different now than maybe what we saw. I mean, there's that kind of sort of shock, like, is this really happening? And the kind of like, how am I going to do it that was going on early. And then it's just become, well, I'll figure out a way to do it, or I can do this for a while. And now it's just, everyone is just, sometimes I know for myself, I've just had this blanket of sadness. Like somehow I do manage to do things. I do get things done. And the people that I'm working with, I'm noticing they're still getting some things done, but there's just a something that's actually quite universal, I think, in terms of how we're all feeling sometimes. And it's just kind of with us all the time, I think, in terms of the recognition, I guess, of the different struggles that people are having, that we know even with the promise of a vaccine, that sort of fatigue of, if we could, it still doesn't change things in a very dramatic or sudden way the moment that happens, in terms of the meaning you were talking about, Nicole, for example, and what people will be doing in their moment to moment. So I don't know if either of you wanted to comment any more on that before we go to the next.
No, I think they are really great points, and sometimes I think it's important to have those kind of honest conversations. Sometimes it may not be that we have solutions at hand, but at times we can look at working together to find certain solutions. I remember one of our colleagues, Kendra, she talks about um, micro mindfulness practices, mindfulness moments. So if I am feeling stressed, and that is not uncommon. We are talking about a recent survey which says nearly quarter of our population. I'm talking in terms of the participants of that work, of that project, have been talking about feeling sad, feeling isolated, having sleep problems. So we are talking about stress, which is real for many of us. So in that kind of situation, I think having those honest conversations, looking at mindfulness practices, and keeping that kind of a connection to remain together and avoid that isolation are certain things that I've seen helpful.
I would just agree with both of you, and if I could just add that I think I've seen just that recognition of loss and grief might look different for different people. Some people comes out as frustration or anger, or like and even for me, depending on how I deal with the day. But it really is just that sadness. So just recognizing that, we're all trying to cope with this, and it could look differently. So I guess I just wanted to add that point. It makes me think I try to be very mindful or thoughtful about what I'm seeing and feeling in that context.
Thank you both. So those are some things that we're kind of noticing or that we're feeling, and I don't know how much that resonates with you as families kind of listening to this. But I wonder, in thinking about, maybe one or two kind of strategies or things that you've noticed seem to be helpful, besides this acknowledgement of this sort of shared experience that we're having. If there's anything you've noticed that seems to be really important that you wish, if you were able to sort of give this tidbit, to some families, that you think it still resonates and it's still an important thing to be thinking about or doing.
So going back to what Nicole mentioned earlier, I think we need to understand that stress is a normal human emotional expression. It is something that can be seen during times of stress, and perhaps we should not pathologize it. Always look at it from a kind of perspective which needs specific interventions. I think we need to look at ways to manage it, but then not necessarily always look at it as when I say pathologize it, I'm talking in terms of looking at it as a disorder or medication or something to be seen from a very medical kind of model. But to understand that this is something which is very, very normal. We always talk about the continuum of stress. When stress is ongoing for a long period of time, that can lead to mental health distress. So stress becomes distress, and few of the persons from that group can also experience severe levels of anxiety or mood issues or other mental health issues. But then stress is real, and many people experience stress. So I think that's really important to recognize. The other thing I think again is important is to look at all the new ways of working. Um, uh, One thing always comes back to my mind is about the telehealth or the virtual care services. So as much as we talk about more online time or more screen time or screen-based activities, and it has got its own disadvantages. There are issues around the digital divide and equity, which we need to always be mindful of. But at the same time, what I've seen in the last year is it makes things so accessible, um, or it also it also helps in reaching out to the person's home, and the person does not need to travel long distances for support. Observation in the person's home environment, and these things can be so helpful. Um, so uh, I think from a clinical perspective, I have seen these things to be really helpful in the last year.
Thank you. Yeah, I think one thing I like, Kendra, as you mentioned, is one of the members of our sort of ECHO team, this team that sort of does these consults with cases. And she sort of has the behavior analyst perspective, but these sort of micro sort of moments are things we can do. Sometimes, I always say, like, if you don't have time for anything, you probably have time to stop and take one breath, right? Like that's exactly when you need it the most, when you don't have time. And it's like, I'm looking outside today and thinking, well, who here has actually gone outside today? Or how is the way you could go outside? One of the things I've noticed, I think, for some people with developmental disabilities right now is, especially with the winter and the cold and whatever, people actually have stopped going outdoors. I noticed there was, and I've heard this from many families, just that moment. The only thing that's sort of consistent is the fact that we have daylight every day, depending on where we live, and we have sunlight, and we have this fresh air that's different from the air we have indoors. And it's always a place we can go. It's always open, you know. But it can be that much harder, I think, at this point in the pandemic to really encourage ourselves and also people with developmental disabilities to just step outside and to see that other world that's happening, in this time, especially if you've been spending so much time, I think, indoors. And it's one very small thing, I think, that can be done, but it's a really important part of potentially structure. Now, I think it can be hard, and I'm noticing a comment here about how, what if it takes so long, just to get out of the house, right? Then what do you do? And it's like, well, it's that balance. And I think one thing we've learned, and we've been saying it a lot over the years, that you still do know your kind of loved one best in terms of how important it is today to go outside, or how important it is to do this activity. That it's not like everyone needs to do the same activity in the same way, but sometimes still having some purpose or some place to go or something to do. And what you get out of that moment of, say, going outside, is it worth all that time it might take, for example, to do that activity? And I think, again, you're going to know that somewhat as families, and you'll also see how important that activity is for the person that you love. But that's one thing, I think, finding that sort of thing you can do seems to be really important. And maybe one other thing I'll add, and then maybe Nicole, we can turn it back to you, is, I've learned this year, I constantly feel guilty. I feel guilty about, how much time I'm spending doing my work versus how much time I'm doing something, for my family, or how much I'm taking care of myself versus how much I'm taking care of other people. And was this the right choice today in terms of how I did this and how I did that? And I think that sense of maybe not quite getting it right is actually a really common thing. I don't think I'm the only person who's experienced that. And you can welcome to use the chat box to tell me if I am the only person who thinks this, but I don't think I am. I think it's something that we're all kind of going through right now. And I've stopped trying to quiet the guilt, or say, I don't really feel guilt, or I never feel guilt, or I shouldn't feel guilt. It's like, well, this is just part of what I feel, and I don't feel it every moment of every day. But it's just a feeling that comes, and then, maybe it goes, maybe it's stronger on a certain day than another, but it's part of what's going on. But I find a certain comfort in knowing that it's also something other people recognize. I remember the first time when I actually expressed that or said that to another sibling during the pandemic, and the sibling said, "Oh, that's because you're a sister. I feel that all the time." And I thought, that's so affirming, to know that some of the difficulties I'm experiencing myself, I'm not sort of alone in those feelings. So I think of it differently now than I would have thought of a year ago, and I think that's a common experience for families. I don't know, Nicole, if you wanted to add to that, or
Yeah, sorry I dropped off there for a second. But I had a couple of things just as you were talking, and I had been reflecting on one. I think is the idea that sometimes we feel like we can't do anything, and I would reframe that to say that being present with someone in the same space is a very compassionate thing, and it is action. It's just we're very programmed into doing and moving and making lists, and when you but you can sit and be a very compassionate. The other piece that came to mind is the importance of movement, and I think both of you talked about it, but movement helps us regulate how we feel, and helps us impacts how we feel and what we do, and we need that feedback to our muscles and joints. And if you can't leave the house, is there a way to help push or pull, or get up and down? And I think one of the things with loss of doing things is that we aren't even walking different places anymore to our activities, or getting in the car and going somewhere else. Like, we're just actually being very sedentary, and I think that there are health impacts of that, and also mental health, mood impacts of that. So and some of the people that I have spoken with, there's been, well, he doesn't or she doesn't, or they don't want to do those things anymore, and I would just offer, and if it's to staff or it's to families, to say, maybe they didn't want to do that then, but let's offer them, let's ask again. Just because we've asked once, I don't want to go for a walk every day, but it's nice just to be asked, and one day I might say yes. So not feeling discouraged if we're getting a lot of no's. And sometimes I frame it as activity experiments. Like, we're not committing to, like, we're going, walking every day. Let's just go try today and see what we can find. And I think with the nicer weather coming, I was really worried about it with folks over the winter. And what we heard from staff was that they were really worried with the inclement weather. People couldn't get outside as much, but even if it's walking in the house, or a dance in the house, or helping to clean or carry groceries in, like, I think there's lots of little things that we can do to use our muscles and joints that can actually help us contribute to our community, whether that's our family home, whether that's our apartment, whether it's our group home. So those are kind of, sorry, I feel like I get very passionate about this, but hopefully it's resonating a little bit.
thanks, Nicole. I don't think we should apologize. I think there's something to be said around everyone being able to contribute to the sort of broader community, whether it's your family community or your neighborhood community, or even the world. If you think about, why is it that we want to get vaccinated? Why is it that we wear a mask? On the one hand, it's protecting ourselves, but it's really this gesture that we're doing that is giving to our people, whoever our people are. And I think finding that meaning, is and also sharing those moments, like you said, even if there's no activity in that moment, are the things we're doing to sort of connect ourselves to other people. I really like your hint also about asking again, or maybe even asking a little differently. I think about, when someone has started using a video game, for example, for a long time, right? And then they don't really want to get off the video game or do anything else. It's really hard, if you play a video game, to separate yourself from that activity, right? The same as it's really hard for me, frankly, to separate myself sometimes from my phone. But maybe asking again, making the thing that we're going to do instead of this thing that's hard to separate from, quite interesting and enticing, as a strategy or a way of, and even getting ideas from other people around how to think a bit more outside the box, to come up with one experiment or one activity that would be a little different. So I wonder, Anupam, if you wanted to add to that.
And I think there are some wonderful suggestions in the chat box also about how we can keep ourselves active, and start with small steps. Um, I think this pandemic has taught us to look at ways to make our life more fulfilling, and to bring some kind of a predictability to it, because there is so much of unpredictability around us. I think if we are able to bring some kind of a predictability there, that makes things life that makes life back to a state of normality in some sense. Am I frozen, or no? I'm okay. Okay. Right. Thanks. So in that regard, I think activities like going out for walks, I have been doing that more now than ever before. I never used to notice the small, beautiful flowers coming up during spring as much as I appreciate it now, the different colors also. And I reflect on that, is it that I was not doing this before? Perhaps I was, but I think I am valuing that more now than I used to. So I think we need to look at those small things that bring joy to our life, bring that predictability back and making it more fulfilling. They are going to be the strengths for us to go through this pandemic.
Thank you both for those ideas. One of the things that's come up a lot for families at this time, especially if they're noticing that their loved one is struggling, is, this kind of wait for services, right? Like, there's a problem, things aren't good, and you want to get people to come in and help you around this sort of mental health issue or this real legitimate struggle that's happening in your family. But the services you want to have there are not in place. And it's a real difficult thing, to be in a system during a pandemic that is not responsive, that is not as available as it should be. And I wonder if there's anything you have found that can be helpful, while you're waiting to see the specialist psychiatrist or while you're waiting to get involved with a mental health team, that families have found is useful despite how frustrating things are. Like I'm supposed to say who's supposed to answer first. So I'm going to give this one to Anna. Go ahead.
So I was actually also looking at the chat to see what families might have found helpful as well. And I've learned a lot from working for the past year. And something that I've learned is to have open channels of communication. So if I am having any difficulties, or if my family is having some difficulties, who should be my go-to person? I need to have one person whom I can always reach to talk about what the current issues are. It may be from the developmental sector, it may be from the health sector, but I need to have someone to reach to. It could be my service navigator, but there should be one person at least I should know. The second is uh, working with families. What I learned from many of I even look at it as a much more wider team. So a team in the home and a team in the office kind of thing. And then what I've learned from this wider team that we are working with is always to have a plan, because families would know their loved ones the best as to what works and what doesn't work over the years. So having a kind of plan to say, if I'm looking at some of those red alerts coming up that things can be difficult, then how can I flag that up quicker so that it does not go to more significant difficulties. But again, that's where I think your point comes up as barriers in the system, where I know when to flag up, but then I don't think the system is responding as much or as quicker in terms of the needs. Which is where, from a health perspective, I always find it really helpful to have links with the family physician, with the e-consults these days, with the phone consults. It has been much more accessible now than before, to look at urgent kind of requests in terms of clinical difficulties, both physical health as well as mental health related.
I think this idea, I really like the sort of home team and the, the team of people. They're in different settings, but they all are potentially working on the same thing. And there may be the psychiatric team that maybe isn't available just yet, but the home team and the family doctor team, are there still ways they can potentially work together? One thing I was thinking of, and I saw a comment about this in the chat as well, I realized for those of you who are writing comments, we can see them as the panel, but I don't think that necessarily all the people who are participating can see them. So we'll try to kind of reflect them back to you. But there are ways to invite more people into our circle when we're doing healthcare planning and when we're meeting. And in some ways, it's easier now than it was before, right? So on the one hand, Anupam, you can call the family doctor, which you could have done before, after an appointment, or send a letter or give an update. But there are also ways to virtually bring people into some of these discussions that we didn't do before, which I think makes a big difference. So maybe when the appointments were in person, we just had one person from the family going, with the person with a disability, or maybe they were going on their own. But with virtual care and with everyone getting better at doing some of these things, maybe more people can take part, and not that everyone has to say something, but everyone hearing that same message sometimes is really important. And instead of having to have this kind of broken telephone thing where one person goes to the specialist appointment and they explain it to everybody else what happened, there's a group of people who are all hearing that message at the same time. And I think sometimes for the person with a disability, it can feel very empowering to have this whole group of people who are care and part of that discussion. And it might actually feel a little bit less overwhelming when it's not all in person in a room together, but it's done through a little bit of phone listening or a little bit of video watching and participating. So I saw someone wrote a comment about meeting cruise directors, having that one person who's kind of the go-to organizer. And maybe just to add to that, there may be that one reliable person either in healthcare or even the one reliable person in the family who's the best holder of information. There's some people might be really good at being cruise director. And then I'm guessing, I've never been on a big ship, but when the Titanic was sinking, I don't know if it was the cruise director who did a really good job or if it was someone else who was really good at kind of dealing with the crisis, right? So there may be someone kind of in the family or someone in your sort of circle or team that is the go-to person who really knows what to do when things are more difficult. And identifying that person, I think, is really helpful so that if it is that situation, we have different skill sets, right? So knowing and being prepared for those kinds of things is really important as well. I'm seeing also in the comments here, this comment about engaging family and asking for that involvement as being a shift that I think families weren't necessarily doing in the beginning of the pandemic, but whether it's just listen in on this call or just be part of this, or let's all have a discussion together, or is what one thing that maybe you can give as an example. I do apologize. The Titanic was a terrible example. So someone put that in the chat box. Imagine like a version of the Titanic where things turned out really well, but it was a very difficult or stressful situation. Apologies. Nicole, you wanted to say something.
I just was laughing about the Titanic, so thank you for sharing that. And I think I just also wanted to acknowledge that families have been dealing with this a long time. Like, and this is part of your, becoming an advocate and reaching out and trying to get services and being supportive. So it's just, I think one of the things we talked about with families is just recognizing that, you are an expert and you've been doing this, and just the pandemic has added another layer and virtual care has added another layer. I think there's opportunities and challenges that come with that. And there was a question in the chat about what because of age, and I think it's something I've had with my mom lately. I'm very part of the team, and could that be a sibling, or could it be a person, a trusted person in your family or friends that your loved one trusts? And I think that's a really important thing that I'm hoping to be a part of as my family and my sister ages. But that's how I would respond, I think. I don't know if Yona or Anupam.
Yeah, no, I'm glad that question was asked, and I appreciate your response, Nicole. I think also as a sibling, and watching my own parents as they age and thinking about our sort of team right? We're always sort of thinking about what's next. We did one of the studies we did actually this year was learning from siblings from around the country, adult siblings, about sort of some of their experiences. And there's always been a kind of worry about the future. And we've got this funny thing going on where parents are like, well, we've already, you know, it's already been enough of a life already having someone with a disability in the family. We don't really want to put too much pressure on the siblings right now. They've got lots of stuff going on. To really needing to change that or shift that. There's a little more urgency, I think, because of the pandemic. And people are really thinking, all of us are thinking, you know, I think about, you know, our mortality in ways that maybe we didn't before, and starting to have different kinds of conversations. And the team sometimes is about siblings, and sometimes it's about just an amazing neighbor or someone who's just a real community person or a very close family friend. And the team also isn't just the sort of family friend team, it's also the medical team, because you might be working with a healthcare provider who's been amazing, but at some point is going to retire, right? So we think about sort of that changing or that planning. We always want to have more than one person involved on the health side, always more than one person on the sort of social support side, because these groups can change and evolve over time. So I think it's a really important point. I can put into here after in the link some of our resources that we have for siblings, and also supporting families and siblings to have some of these more difficult kinds of conversations. I wonder if that's kind of a segue or thinking about other sort of like, we're seeing a few questions coming into the chat, so we can maybe read some of them and think about other ideas. One idea that I'm seeing coming up here is really about kind of how do we, someone says the exhaustion of the cruise director. Any of you who are in the cruise director role, about just how tiring it is to be in that role, and just to be able to sometimes be in a space where people can listen to that exhaustion without trying to fix it or adjust it. You know, I think even when we were talking about planning this this webinar, and I guess hopefully it'll give us your feedback on how it went, we were really torn between trying to say, well, here's the 10 pieces of advice we want to give everyone, versus actually just making a space to acknowledge there's some things we actually don't know. And there's some things that frankly are just difficult. And how difficult it is for us as clinicians, I think, to say that, right? Because we feel like we're supposed to have answers. But sometimes we just have to acknowledge that we're still asking questions. And I think certainly in thinking about how things will change or evolve with this pandemic and what's going to happen next, we don't know exactly, right? Some ideas about things we found that seem to work, but there's a lot we really don't know that we have to kind of work on together, I think, and figure out. So no, Anupam, if you wanted to add to that.
Yes, Yana, I think there are certain things which are very real in this time of the pandemic. Initially, it was physical health related anxieties. If you look at March, April, May time last year, the stories we were hearing from Europe, from the US, even more closer home, here in Ontario, in some of the long-term care homes. But other than that, I think it has touched everyone, every person, certainly from my interactions with people. Um, Grieving over loss of friends and relatives, um, disproportionately isolated, be it due to quarantine or self-isolation, the demands of being isolated, um, sometimes not by choice. And again, we are talking about uh, the team that you mentioned. It's also about working to find different ways to help our loved ones to be engaged in different meaningful activities when certain things have stopped, like day programs. So these kind of stresses are quite real. And going back to Lee's point mentioned in the chat, that this can bring a lot of stress, and to acknowledge that stress and to be able to work with people who are caring for people with developmental disabilities is, I think, really, really important. Because if we are not able to take care of our own mental health or our own well-being, I think it might be more difficult to take care of our loved ones. So sometimes in our efforts to take care of our loved ones, perhaps we might find it that the stress has gone such a long way that then it becomes really overbearing. So I think it's really important to take a moment to think about ourselves also in terms of our own well-being in this time of the pandemic. So that's something that I think is really, really important.
Thanks for that, Anupam. I just wanted to acknowledge or to clarify again, because a question came up in the chat. There's different kinds of software, and the software we're using today actually allows you to ask us questions, but you can't see those questions or send them to everyone else. So that's why we're trying to sort of repeat some of the questions and things that we're getting. And we are getting a lot of them. So we do apologize if in advance we're not able to answer your direct question today. But we are trying to sort of monitor them and look at some similar themes and things that we can share across people. I think that sort of space is really kind of what you're talking about, Anupam, just sort of the space we need to create, the space that families are asking sometimes that they need, and their recognition. And us remembering as well, I think, as clinicians, we need to remember to allow for that space and to know from the feedback we are getting that sometimes, you know, that honesty and giving that space is important. It doesn't necessarily make people feel better, but I don't know if our job during this pandemic is to help everybody feel better. I think our job maybe is to help everybody keep going and for us to take as good care of each other and ourselves as we can. But I think it's unreasonable to think that we're going to feel better. We're going to have moments that we can try to appreciate where we feel good and where our loved ones seem happier. But it won't be like that all the time in such a difficult and uncertain, chronic kind of situation.
So something that just came across my mind now, and it has been used in different contexts, is about psychological PPE. So in this time of the pandemic, I think we should be looking at our psychological PPE to look at the wellness part that you just mentioned now about the space. I think remaining connected, sharing with others, friends and family, those things are our psychological PPE at this time. Maybe not the whole list, but at least some of them.
Might be a helpful list for people to be able to see what all the different parts of psychological PPE are that they put on. You know, we have this whole process in healthcare, and we have to update it every year to show that we know what PPE we put on and the order in which we put it on, right? So it's not just that we have to have the goggles and the gloves and the gown, but there's, you know, first you have to do something, then you do something else, then you put something else on. And also when we take off our PPE, we have an order to that as well. And so I wonder with psychological PPE, if there's certain things we need to do first, followed by something we do second. And also when we're sort of debriefing or we have a moment to ourselves after, if there's also an order to that in terms of how we sort of let our guard down and sort of come back to ourselves. I don't know, Nicole, if there's anything you wanted to add to that? So Nicole, I'm just going to interrupt you. I'm not sure if it's just me or not. People can put in the chat box if it's them, but I think your Wi-Fi is a little bit fuzzy, unless it's my Wi-Fi. So you can't hear Nicole. Okay, so it's not me. So Nicole, your sound is a little bit, that's okay. If you want to put some of your thoughts that I'm sure were brilliant, and maybe even the best brilliant thought you've had since we started, pop it into the chat box and we will repeat it, because your visual and your audio is a bit broken up. So yeah. Anupam, was there something you wanted to add?
Yeah, so a few things from the chat, maybe if I can address, as much as I can. One thing was about access to different softwares, access to screen, and being able to navigate through the screen. I think it can be difficult for some persons with developmental disabilities, and that is where I think, as a system, we need to acknowledge that aspect and look at making things more accessible for people with developmental disabilities. I think we have done some great work there, but I think there is still a lot of work to be done. So it may be use of different tabs, or how can we make things more visual? How can we make things more simple? How can we make consent forms more simple? to understand. I'm talking about the things that we heard recently about vaccines. So I think in terms of use of technology, that has got lots of positives as we discussed earlier. But I think to make it more accessible, we need to acknowledge that screen-based technologies may not work for everyone. But how can we make that really helpful as a tool to connect and get access to care? The other thing I think there was a mention about mental health related concerns, and without going into the details of the clinical symptoms, I think we need to think about certain mental health related difficulties can exacerbate during the time of pandemic, and we need to be mindful of that. But as I said earlier, we need to look at quicker access to care in those situations and not wait till things become more difficult or more severe in intensity. I will just quickly go through the chat and then I will come back to address some of the more specific questions around mental health, if I can.
Thanks, Anupam. One of the comments that's come up a couple of times from different people is this kind of fear about we've all sort of developed this new way of being. So both us and our loved ones who have disabilities. I know for me, I kind of wonder, someone said to me, well, you know, when this is over, we should meet and we should have coffee and we should talk about that issue. And I thought to myself, I have no idea how to go out and meet someone and have a coffee. You know, like I don't do that anymore. That's not part of my repertoire of behaviors and activities. And I think for people with disabilities who maybe have become really used to living a fairly simple and often very indoors life with less routine and less engagement with other people and fewer rules, except for let's mostly stay here, just us, and do just these things. How do we get back to that, whatever that is? I think that's one of the things where I say we don't have the answer, but we do have other answers or things we can learn from other groups. So we can look, for example, at how someone who's been hospitalized for a really long time adapts or works on going back into the community, right? Or someone who's had a long illness for a long time adapts and goes back to doing different kind of behaviors. And we know that we go slow and that change is gradual. So taking opportunities, I think when we have them, even as Nicole was saying before, as the weather's getting a little bit nicer, and even if it takes a while, just trying as an experiment one little thing or one little activity and saying, wow, we did that today. Pretty awesome. Or, ooh, that was a real challenge, was it? I wonder if next time, how would we rate it? Would it be quite as challenging? Could we do anything? Could we tweak that a bit to make it go a bit more simply? You know, but recognizing that there's so much to get from where we are now back to maybe where we want to be, that we're only going to get there through a number of very small steps. But over time, we do still get somewhere. And so it's important to take some small and safe steps, I think, using the spring and summer months, especially when people are vaccinated and are feeling a little bit safer, to start to sort of test out and practice doing things. And knowing that we may not be going back to what we were doing before. But there's also opportunity sometimes in that, as I've seen even in the chat, about some different things we could do or things we could do differently that we didn't realize we could manage with as we sort of reintegrate. So I don't know if Anupam or Nicole, you wanted to add to that.
Yeah, I think the key message there for me is about small steps. So change in whichever direction, I think small steps to manage that change will be helpful. That actually takes me to one of the things mentioned here in the chat, and I've heard this before several times. For some persons, with this pandemic, not going out, no day programs, staying in the home has been more of so some people have been feeling distressed because of this, and other persons have actually felt I like this new normal. I'm really doing really well in this. I don't want to get out of this. So I think the question in the chat was, how will we get the PPE of this person when the pandemic is under control? And that takes me back to what you mentioned earlier. I think it might still again need those small steps. Perhaps it will be really difficult to try hard and go back to normalcy. For example, if certain activities open up, it might be difficult to straight go there because we need to look at things like, is the person having sensory overload issues, or having difficulties with lots of people around, or any other things that might have been difficult in situations involving social contact. So again, taking those small steps to go back to what the person used to do, to bring a kind of a schedule into the activities, might be worth looking at in those situations. But I like the way it was described about how do we get the PP off the person.
I think it goes back to the dawning off, right, and the steps that we take, and recognizing too that at a certain point, when there's an outbreak, we have to wear certain levels of PPE, and at another point, we're just wearing surgical masks. So we're not taking all the PPE off necessarily. We're just sort of thinking about certain layers that maybe need to come off initially. I'm thinking about, for example, in the work world, we've learned that a lot of people who've been working virtually or working from home are looking at, even when they return to work, maybe there's other work they can do without going into the office, right? So maybe they're going to have like a half time at work, half time at home. And so is the right model for people who have disabilities to do exactly what they did, exactly as they did it before, because that's what was done? Or is it an opportunity to think about if there's something, that one individual in the example really seems to appreciate or enjoy certain aspects of their living right now that are simpler? Are there certain elements of that to think about keeping as we try to change or go back to something different? I think these are important questions. And maybe I think we sort of thought before the pandemic that things just are the way they are, and that's how it is, and that's how we do things. And we were suddenly forced to realize that's not necessarily how we're going to do things now, right? So are there different ways for us to do things, whether it's how we work with healthcare, or what we do during the day, or what is considered sort of acceptable behavior, or what we eat, when we eat, who we're with, all those kinds of things maybe will be a little bit different in the future. And we can all have a voice in that. This is, something we always say, the ABCs, all behavior is communication. So what's the behavior kind of telling us, in terms of what somebody wants or what makes somebody happy? And how do we listen to that and make sure we're sort of heeding that and the kinds of things that we're looking toward doing in the future? I feel bad for Nicole because of one of her technical days. I'm sure everyone who's listening today can relate to like the day where your tech doesn't work properly. But I think it's a bit tricky for Nicole to speak at this point. So Go ahead, Anupam.
Thanks, Yona. So just there's mention of Kaizen in the chat, and that takes me back to my Toyota lean thinking training days. Kaizen is about making small steps for improvement. When you're talking about taking those small steps, and it is actually something that we have been looking at in the last year or so. We have been innovating constantly. We have been trying different things, sometimes not with a great deal of success as processes. But I think it's always about learning new things and seeing what works in that process of Kaizen.
Maybe that's an interesting note for us to sort of try to wrap up our chat today, thinking about some of the amazing things that we have observed or learned that have challenged or surprised us and that excite us, I think, about things going forward. I know the technology piece, Anupam, has been interesting. I was 2 meetings just in the last few days that, kind of reminded me or surprised me. We had a meeting this morning with some self-advocates from the UK, because we're looking at different things they do in the UK and things we can do here. And we were talking about vaccines, because a big reason I think that helped folks in the UK shift their vaccine policy to make sure people with disabilities were included was these voices and this platform that some people with disabilities had. So we were listening to some of these individuals telling their stories, and I was struck at how fantastic this group was using Zoom and sharing the platform with each other, taking turns, knowing how to do stuff with their mics and how to and how freeing it must be that they've mastered that technology and that they can meet with a total stranger, and have this discussion and really participate together. And I realized not everyone can do that. But another example was just an activity that I was doing earlier this week with a number of people with developmental disabilities. And, many of them had their own tablets. And I don't think they'd ever had a tablet before in their life. You know, I think we thought, well, those tablets, that iPad, that's a bit of expensive, whatever. We can't really trust them with that, or that, what would they use that for? And here we're all sitting here, and everyone's got their tablet, even if they don't have too much to say, it's theirs, and they're watching stuff. And when it's their turn, they're waving. And there was just a certain kind of pride or participation that I was seeing that I don't think I would have thought to have made happen before, because I just had this assumption that some people really wouldn't benefit from tablets. Well, we benefit in different ways. I'm not saying everyone has to use them all the time, but it was just interesting to see what happens when that's the only alternative, how that use has changed over time, and how much I think people have to offer us around maybe things that could happen that we didn't think would happen, or that could happen, or in different ways that we expected, to sort of keep me thinking, and not sticking with one way of thinking that things are. So I don't know, Nicole or Anna Pam, if you have any final words. Nicole, give it a try.
Can you hear me? Yeah. Okay. I've just been so grateful this year to connect with people from around the country, to hear family stories and to hear self-advocate stories. Like, it just opened, I just felt opened up a world and a community to me that I hadn't had a chance to meet before. And it's such a powerful thing, if we can leverage that, because I think we are seeing in our ECHO a lot of system level issues that we can, we can pull together and continue to advocate for with more voices. And so technology can help us leverage that.
Thank you. And Anna Pam, one more observation or thought from you before we wrap up today?
So this past year has taught me many different things. And then, as Nicole said, I feel very privileged to be part of this community of practice, of working with different team members, not only within the health sector, but even wider in the community, working with families, working with self-advocates as part of the ECHO project. But at the same time, trying to look at situations, things which are common to everyone who is part of that community of practice. So when I talk about the pandemic, which has touched every one of us, each one of us, I think then we are all talking about the same thing. We are all on the same page and trying to look at solutions collectively. That has been a really, really great experience, a very rewarding experience for me.
Well, it's been very rewarding for me to be able to spend the last year working with both of you, and also with realizing, as you said, Nicole, how big our world is and how easy it is in some ways for us to be able to learn and hear from people, not only here in Toronto or here in Ontario, but across Canada. So with that, everyone, we wanted to thank you all for joining us at our fireside chat today. We did make a video of today, and we will post that and share it so other people can watch it. And we are also very happy to share different kinds of links we've developed in terms of mental health resources for you and for your loved ones. And if you have more questions or more topics you'd like to see covered, we're happy to have more of these chats. So let us know in your feedback what you found helpful. Thank you for giving this hour to us, and hopefully to yourselves. Hopefully you got something from it. And we look forward to seeing you again. Thanks, Nicole and Anna Pam.